Good morning from the UK, and I want to wish everyone joining us today a very warm welcome to this symposium on autism research into practice. It's a real pleasure to welcome you all, and it's been lovely to see already the chat on the live stream that we've got running. I'm co-hosting this day with Dr. Catherine Aldred, who you'll meet later this morning. I'm Jonathan Green, Professor of Child Psychiatry at the University of Manchester. And I'm a clinician and a researcher, and been a clinician for over 30 years, working with early social development in children and adolescents, and particularly with assessment and intervention with autism spectrum conditions. I've led quite a number of the research studies that you will hear talked about this morning, as well as being a clinician in practice. And increasingly over the last few years, we've become really interested and somewhat frustrated by how we can get the evidence that we've generated into the everyday clinic and for the benefit of families and children. So that's really the purpose of the day today, to discuss. We're delighted to welcome, we think, up to around 500 attendees from UK and internationally to join with us today in discussing these issues. Wonderful to have you all with us. And we look forward to having a good time and a productive discussion together. Thanks. To get the most out of today, there are, as most of you will know, some technical things to do on the online platform. We do want to make the day as interactive as possible. And so please send in your questions, your comments, using the chat function on the platform that you have. Mention who you want to speak to or have a question for, and we will try and collate and manage those in question and answer sessions through the day. It's quite a thing to attend to a Zoom, online meeting like this for a whole day. And so we put in some breaks in the morning, lunch and afternoon. And as part of that, have developed an arts program for your entertainment and a bit of light relief for us all. So we hope you enjoy that. If you've got any problem during the day, the email address here is the place to contact or use the chat function. And don't worry if you miss something, because everything's being recorded and you'll be able to watch elements of it again at your leisure. Thank you. So to introduce you to the conference team, next slide. It's Tanya and Kelly have been working huge amount of work in the background to make this possible for us to present to you. So great thanks to them. When you put your question and chat responses onto the online system, you'll be speaking to Kelly and Tanya. And then Chris is our AV wizard, who's developed the online platform to allow us to integrate so many speakers today. So many thanks for him. Thanks, Chris. So what's the challenge we're addressing in this day? Across healthcare, there is what we call an implementation gap. That is that there are plenty of interventions that have evidence for effectiveness, but it's well known within healthcare that many of these interventions don't actually get into everyday clinics, so for the benefit of patients. This is across healthcare. But within autism, we have a particular severity of this gap. And it occurs both in what we call the detection gap, that is actually identifying children, young people with autistic spectrum conditions. That's a major issue which we're not going to have time, and we don't intend to talk about today. But following on from the detection and identification is the care gap, that is getting relevant evidence interventions at the right time to children and families in the right place to help them. And that's what we call the care gap. It's difficult enough, bad enough in high income countries, what I've called HIC here. But most young people, children with autism, adults with autism, live in low and medium income country settings, that what we call LMIC. And there the care gap is huge, absolutely enormous. And so today we are particularly perhaps focusing on the UK, but really we have an international perspective. This is a global health issue. And we're lucky enough to have speakers this afternoon from around the world who will share their experience with us. Crucially, to address this care gap, which is our subject today, we need both a dissemination of evidenced practice, in other words, to get out there what the research evidence is, but we also, in a complementary way, need models of health system delivery to best implement those interventions. And those two aspects are equally important, and we'll try and touch on both things today. This is the problem. The implementation gap is what we seek to address and discuss today, how we can get evidenced interventions into everyday clinical care for the benefit of families. Thank you. So what about you, our attendees? As I say, there are probably around 500 of you, UK and in other countries. And this implementation gap and the health system that supports it is a complex system with many actors and stakeholders in it. And one of the great things about today, which we're really excited about, is that we have representatives of all these major stakeholders, if you like, in the health system around autism, represented in our attendees and able to contribute. Speakers, but also all of you attending. So we have parents of children with autism, adolescents with autism, but autistic individuals themselves. You are, of course, the key users of services, the beneficiaries, hopefully, but increasingly you co-construct the ideas for health system delivery with us, and you're key partners in the project here. There are professionals who are delivering care and, of course, highly invested in their practice, who need to learn new evidenced interventions and sometimes change what they're doing and be flexible, but have huge amount of clinical wisdom to add into the system. There are policymakers, commissioners, managers, people who manage the health system and who fund us, who decide which treatments are going to be used. These are crucial people, of course, as well. And we're lucky enough to have them represented today as well. And then there are in the background funders, charities, philanthropists, people who really support the whole project and help us do what we want to do in practice. So all of these groups are together here today, potentially interacting today, and all of you together are going to be necessary to make the change we want to make. Thank you, Chris. We will need to all work together. Because this is a complex system, we need to work together to activate change. Thank you. And we know that when we work together, all components communicating and acting in reasonable synergy and in dialogue, we are hugely more stronger and hugely more effective. And that's, if anything, I hope for coming out of today is that we can generate some energy, combining all these different stakeholders into a sense of common purpose. Thank you. So in order to develop that, our program really covers various elements of the landscape. Everyone's got a different perspective. No one's got a monopoly of wisdom here. We all have our different experiences within the autism field as parents, families, professionals, etc. And we can learn from each other. So there's the basic research that has to be done to develop and test innovative treatments and provide the evidence of what works and what doesn't work, and if it works, how it works. We need the policy people to generate guidance built on that evidence, philanthropists and research funders to support research and innovation. And then we need theory. We need people who'll help us understand the landscape and the path that we need to follow to get evidence practice into the clinic. And this is not always straightforward by any means, and we'll hear about that today, but the theory is an important aspect. And then we are going to be talking about a lot of practical experience, what we have tried to do, how it's gone and how it's worked or how it hasn't worked so well, both in the UK and internationally. So all of these we're going to cover today. There is a particular focus on an intervention called PACT, the Pediatric Autism Communication Therapy. The reason for that is because it's a therapy that Catherine and I have been very involved with, along with colleagues in Manchester and beyond over the last 20 years, and have developed a strong evidence base for. So it's one of the best evidenced early interventions. So we know it well, and it's got evidence. So it's a paradigm for us, an exemplar to think about how we can get this kind of evidence practice into the clinic. But the ideas we're going to talk about here have much more generic value and should be applicable really across the board with other interventions that have evidence. And there are other interventions. We're by no means suggesting in this day that this is the only intervention. There are other ones that have good evidence, although it happens to be the case that a lot of work that is done, often well-meaning work in the clinic, doesn't have good evidence. And that's part of the implementation gap, is that sometimes the evidenced care doesn't get into practice and practice isn't evidenced. And this is an important gap for families' effectiveness and cost effectiveness. Thank you. So you've already seen, no doubt, as you were waiting to come in, the program, and we sent you the pack before today. So you've got a detailed program along with the biographies of the speakers that you're going to be able to listen to today and question. So I don't need to go through it into detail, but just to say that the first part of the morning before the break is really focused on setting the scene with some of the basic science, which I'm going to let you know about, some of the philanthropic and funding background from Dave Stephanie Shirley, and some of the national policy framework from John Spires. And that's going to set us up really for then later in the morning to talk about some of our efforts and implementation within Greater Manchester. And then this afternoon, Catherine will be hosting us to look in more detail at some of the implementation projects, both in other parts of the UK and around the world. And then we'll end with a question and answer session at the end of the afternoon, as well as the end of the morning session, plus some parent forums, etc., which you'll have been told about. Thank you.